I'm Dr. Paul. Today I want to talk a little bit about how this affects families when you've got one person that's real ill. Now, you can have light cases. You know, this is a person that gets grumpy, they don't sleep well, they take Ambien or something to sleep, or they, maybe take Xanax, and, one day they're happy, one day they bite your head off. I mean, they're just like that. And so they just get diagnosed with things like clinical depression or anxiety disorder. Those kind of things are given some medicine, but it's all the same stuff. It's just a lighter case. You turn that rheostat up real high, and it'll put up these same people would be in a wheelchair. Now all of a sudden they don't sleep at all. They've got anxiety problems, they've got intestinal problems, they've got everything going on, and it becomes a really severe problem. So how do you think that affects their spouse? When you turn the sympathetic nervous system on, which this does, it shuts down your sleep, your intestines, and your reproductive system. You don't want to have sex, and half the time it hurts anyway. And so that shuts that whole portion of your marriage down. And then as far as going places and doing things, too sick. If you're bad enough, you're in a wheelchair. And so friends quit coming over because they don't know what to do with you. Oftentimes the kids will disrespect their parents, just, who's sick, because they think they're grumpy and unreasonable. But then you've got the other people that just adore that sick person and take care of them and dote over them. And the husbands or wives just are so good. And these are the ones I typically saw, because they would come in with that spouse that just loved them, would do anything to get them well. And so, again, that's part of what we do now, is we actually have spouses that come in and get trained and then go home and take care of their family. We don't have an office now where people come to get well. We train their spouses. We train a loved one, somebody to take care of them. And we have them, if they can, we have them bring that person to us on that first weekend of training, so we can work on them and help determine what needs to be done, so it gives them a head start on the whole thing. This is big problem. We're talking about probably 8% of the women in the United States have fibromyalgia alone, not including CRPS and trigeminal neuralgia and most of your chronic pain problems. So this is really, it's a big problem. And next time we're going to talk about children and how it affects them, because most people miss that one completely. So please tell somebody that's sick about what we're doing. Share what we're doing so they can watch, and I'll keep teaching. And we're doing some really good work and training a lot of people around the country right now, and I'm really excited about that. So share and like, really appreciate it, and I'll talk to you tomorrow.